welcome back to Rural Health for You and Everybody. I'm Amber Sorensen, the Marketing Director at the Murray County Medical Center, and I'm here with Emmie, and we're going to be talking about all things strokes today because it's American Stroke Awareness Month in the month of May. Hello, Emmie. How are you?
I'm good, thank you.
Good. Why don't you take a minute and introduce yourself to our listeners?
Yeah, my name is Emmie Lolkus. I am a nurse here at Murray County Medical Center. I'm also the stroke coordinator, and that means that I review all of the strokes that happen here at the Murray County Medical Center, and I provide education to the community about stroke recognition and prevention, and then just make sure our stroke patients get the best care that we can possibly give them.
Awesome. So, just to get right into it here, like I said, May is American Stroke Awareness Month, so that's kind of why we're here today. So, just to get into it, for those who may be less familiar with strokes, what is a stroke?
So a stroke is kind of like a heart attack for your brain. There's two different kinds of stroke. The main kind is when a clot forms in the blood vessels in your brain, and then part of your brain will not receive oxygen because of that clot. And when it doesn't receive oxygen, that part of your brain will eventually die. And there's different parts of your brain that control different parts of your body. So the symptoms that people have of strokes depends on where that clot happens in your brain. And then the other kind of stroke that is less common is a hemorrhagic stroke, and that's where you have a bleeding that goes on in your brain. And that too can depend on where it's happening in your brain on how you're affected.
For sure. So, obviously, it's kind of along the lines of heart attack, but for your brain, so it's probably important to act quickly if you think that you're exhibiting signs of a stroke. Can you get a bit into that for our listeners?
Yes. So in order to give you the best outcome, if you or a loved one is having a stroke, the sooner that we can treat you at the hospital, the better chances of you returning to a normal life, the previous life you had before stroke symptoms. So don't delay getting to a hospital if you or a loved one is having signs or symptoms of a stroke. Because the sooner we can get that oxygen back to the brain, and we do have treatments that do that, the better off your outcomes will be.
For sure. And what are some of those treatments that may be offered if people come here to Murray County Medical Center, for example?
Yeah, so the ultimate goal to get you back to previous stroke life is to break up that clot. And we have medication that we can give you that we call a clot buster. So giving you that medication will break up the clot, get the oxygen back to the brain, and get the brain working again. We can do that if that can only be given within a certain time frame from when your symptoms started or when you had your last known well. If you are outside of that window, we would coordinate with bigger hospitals that have, we call it endovascular therapy. So they would go in and, kind of like an angiogram, where they go in and retrieve a clot out of your brain to open up that blood vessel to get oxygen back to the brain again. So either you would be treated here and then monitored in Sioux Falls or a bigger hospital, or you would get it's kind of a surgical intervention for a stroke.
Interesting. So you did mention some of those symptoms that people may be experiencing. Can you get a bit into what people may want to be on the lookout for if they think they might be having a stroke or their loved one?
Yeah, so there are a couple common ones that we see for people having strokes, and we try to help you remember them by using the acronym B FAST. And so those are the signs and symptoms. So B stands for balance loss. So if you have coordination or balance, sudden difficulties with those. E is for eyesight change, so a sudden change in your vision Maybe it's blurry, or some people will call it like they have a curtain that was pulled over one side of their face, and so they can't see certain areas of their vision. F in BFAST, F is for facial droop. And it's usually one side of the face will have a droop to it, so we ask people to smile, and the one side of their smile just doesn't come up to a normal smile, or they're having numbness on their side of their face. A is for arm weakness, and it can be arms and or legs. So a weakness or numbness, tingling that's on one side of their arms or their legs. S is for speech, and usually it's like a slurred speech, or they're unable to speak, or they're unable to understand what you're saying to them. So sometimes people will ask them a question. They'll answer us in normal speech, but it will be unrelated to what we're asking them. So speech can be kind of a variety of things. And then T in our BFAST acronym stands for time. So call 911, we want you to do immediately. And then also time, we want you to try to figure out, and we're going to ask you when we come in contact with you, when was the last time that you were normal? And that can be tricky sometimes, especially if you went to bed and you were normal and you woke up and you were not. So we would actually go back to the time you went to sleep. And we want to know a clock time. So if you're bringing in your loved one who had these signs and symptoms, we don't want you to say, oh, they happened 10 minutes ago. We want you to be able to tell us that it happened at 9 o'clock or 9:15 or something, like some clock time, so that we can write that time down, and that's our goal. We go from that time to get you to the treatments you need to get better.
For sure, for sure. And just to clarify for our audience, they may experience kind of one group of symptoms, so the F symptoms that you were just talking about,
yep.
Or maybe it might be all of those.
It could be, yep.
Okay, cool.
Yeah,
cool.
but just one of them qualifies
Just
you to be having a stroke.
Good
so,
to know.
Yep,
Good to know.
absolutely,
For
good
sure.
question.
So kind of getting a bit more into it, if people aren't necessarily actively having a stroke, what may be, I guess, kind of top of mind for them to keep in mind if they're kind of contemplating their risk factors this month while we talk about strokes?
Yeah, so there are things that put you at risk for stroke that you can change, that you can do something about, and there are things that you can't, that just put you at increased risk. So let's talk about things you can change first, because we can do something about those. So having high blood pressure. So managing your blood pressure is probably the number one thing to help with stroke. Being able to control that, and talking with your primary care provider can help you manage your blood pressure. Also your cholesterol levels, so getting those checked, knowing if you're at risk for high cholesterol. And MCMC actually offers those ways to check those throughout the year, so be on alert how we can do that for you. Staying active, being physically active, getting out there and walking, or whatever makes you happy to get your body moving and maintain a healthy weight. Eating well, getting plenty of your vegetables, your fruit, having a good balanced diet. Stop smoking is a huge factor related to stroke. So stop smoking, stop using tobacco. If you have other comorbidities, so diabetes is a main one that puts you at higher risk for stroke. So having a good manage of your diabetes, which Murray County Medical Center also offers with diabetic education. And then taking all of your medications as prescribed. Another big risk factor for stroke of comorbidity is having an irregular heartbeat. So if you've ever been told that you have AFib or atrial fibrillation, that increases your risk for a stroke, but you can make sure to take your blood thinner or different ways that your provider helps you manage your atrial fibrillation, can decrease your risk for stroke then. Risk factors that you can't change. Your risk for stroke increases with age. So as you get older, unfortunately, it goes up. But knowing that makes you be very mindful, especially around your, I call them wiser people in your life. They're not older people, they're wiser people. So risk of stroke doubles every 10 years after you turn 55. Men are more likely to have a stroke than women. Although if I look back at our reviews of our cases, that does change. We've had more strokes in women some year. African Americans are 2 times more likely to have strokes than Caucasians or whites, and then all those other things increases the diabetes, high blood pressure, abnormal weight or obesity, that increases with it too. And then having a family history of strokes in your family, they also contributes to your factors that you can't change. But knowing it is very helpful to make sure that you're aware of it.
For sure, for sure. Well, you answered all my questions. Do you have anything else to add before we wrap up here?
I said it a little bit earlier, but the other main thing that I want people to know about strokes and getting the best stroke care for yourself or your loved one is call the ambulance. Call 911. I know that people think that they can get their self or their loved one to a hospital faster if they just put them in the car and drive them to the hospital. But what a lot of people don't realize is in the emergency department, if you call 911 and you use our ambulance to get you to the hospital, we are more prepared for you when you get to the hospital, and we can expedite your care a lot faster. The first thing we do when you come in for a stroke is we take you to CT. You may not know it, but we don't have people here to run our CT 24 hours a day, especially in the middle of the night. We have to call them in. So if you call 911 and tell them that you think you're having a stroke, we can call those people and get them here a lot quicker than if you just show up at our door and say, I think we're having a stroke. Now we're already behind the 8 ball. So giving us that heads up and using the ambulance to get here, I can tell you just by reviewing past stroke cases, you get higher quality care faster. And then the ambulance also provides services before you get here that help us as well. They check a blood sugar, which can mimic the signs of a stroke. So they check that before they get here. They make sure that you're stable enough to go to CT, which quickens getting there faster. And if you or your loved one were to become unresponsive and need CPR, which can happen during a stroke, they provide the best of that while you are on your way to the hospital. So some things that people don't consider, that they don't know what goes on in the background.
For sure, for sure. Well, thank you for being here, Emmie, and thank you for all your insights. It was a pleasure to have you.
Thank you.
And if you'd like to make an appointment with your primary care provider to talk about some of those risk factors that Emmie mentioned regarding strokes, you can call the Maury County Medical Center at 507-836-6153. That's 507-836-6153.